2012, my wife and I found out we were pregnant with twins, TJ and his sister Talbot. We found out early on in the pregnancy that TJ was going to be born with a very complex critical congenital heart defect called hypoplastic left heart syndrome. He underwent the first of 3 open heart surgeries over the next 2.5 years.
There was no harder moment in my life than, I think especially that first time at 2 days old, having to hand him off to doctors. Didn't ever seem to get easier.
We stand here today as parents of a almost 5-year-old boy who's happy, healthy, and we have a lot to be thankful for, and a lot of that thanks starts here at Levine Children's Hospital.
The HEARTest yard was established by Greg and Kara Olson because of their experience with their son TJ. They found it overwhelming to take care of him when he was discharged from the hospital following his neonatal surgery. They were able to then hire a nurse to live with them, and it changed their lives in a positive way, and they wanted to be able to provide that for all of our patients who've had similar surgeries.
And here we are.
Here we are.
That conversation has led us down the past
5 years later.
5 years to where we are now. So as the HEARTest yard has kind of reached its capacity in its original form, we always have tried to think bigger. We've always tried to think what the scalability of this program is and where the future of healthcare was going, and specifically in the cardiac world for pediatrics.
Conservatively, 50% of our patients who've had infant heart surgery and all the experiences that revolve around that are going to have some sort of neurocognitive deficit.
Usually the heart isn't the problem. It's to figure out what the challenge is for the child and intervene.
As a mom, if I didn't have other children, I wouldn't know what's okay for TJ and what's not okay for TJ. And I remember I'd say to the pediatrician, "Is his speech okay?" And they'd be like, "Yeah, he's fine." But they only saw him for 20 minutes, say once a year.
When Gray was born, we knew he had a heart problem maybe day 2, but not how serious it was going to be. And that's when it really sunk in that we were going to deal with this for the rest of our life. After his transplant, he's technically fixed, but we've encountered other problems.
Richard was born perfectly healthy, pink and perfect. He was born on a Monday. We went home healthy on a Wednesday. He actually turned blue on Thursday night. He had his first surgery on Friday morning to correct the interrupted aortic arch. The doctor's like, "Yeah, he's a miracle, but something's gonna show up, Sherry, something's gonna show up."
Gray just never thrived. I don't think he set up until he was maybe 9 months old. Gray didn't speak until he was 3.5. We had a lot of social issues for a while.
It's small things that you don't really think about. He had heart defects. Why does he have learning disabilities? But they go hand in hand.
I wish we maybe could have had somebody help us coordinate that a little bit better.
Let's centralize the care for every type of possible issue your son or daughter may have by bringing all these multidisciplines under one roof, coordinated by one staff who knows all the needs of your child.
Very few programs in the country have this sort of program. And I think parents having this for their child's long-term care is going to set this program apart.
I wish there was something that could have helped. If they could have figured it out when I was in elementary, I wouldn't have had to deal with it in 5th, because I would have already known.
I would be thrilled to get in front of somebody and say, "What now? Help me coordinate everything, make sure we're continuing to do the right things, and help us continue to excel."
We begged for help for years. So the fact that they're going to identify these kids, it's a gift for these families that they can say, "Oh man, somebody's going to help us, that I don't have to figure it out on my own."
When I started in this field, most patients with hypoplastic left heart syndrome like TJ had died, even with intervention. Now, most of them live. And so we kind of have a good problem in that we have to deal with the consequences of having them survive. This clinic is going to impact the patients that we serve here because it's going to help them and their families understand subtle developmental problems that they have early on in life.
If they have trouble with reading, get them in with educational specialists early on so that they catch up with their grade levels before they're multiple grade levels behind. So early intervention is the key, but you can't have early intervention unless you identify the problem up front.
They deserve every opportunity to live their life no different than everybody else, but they happen to need a little hand along the way. And I think as a community, we've shown that we have a lot of very passionate people about children. We have a lot of passionate people about this hospital. And we hope to be able to attract those people to our program and say, you know what, I want to be a part of what the Olsons are trying to do.
Greg's an awesome guy. I've gotten to meet him and hang out with him several times because of things that he's done for the heart community. But someone like Greg can say, hey, this is a problem in our community and this is how we can fix it.
This is something that we're very committed to. This is something that we feel very strongly about, and we're going to do everything we can to make it grow as rapidly as possible.
A comprehensive program like we're envisioning would not be possible without significant philanthropic support.
If everyone comes in, we can make such an impact on these kids' lives, and they deserve it. We really feel like this is going to make a lasting impact on this community, and we're really excited to kick it off and to see what the future holds for the Hardest Yard.